Hello everyone, I'm Dr.Abhijit Tayade, your knee, hip and shoulder expert from New Delhi, and welcome back to my channel Orthopedic. As you know, ACL surgery have become very common, and because of that, the failure rate has also increased. And because of that, revision ACL surgeries have been increasing day by day. These failures cannot be ignored. To restore the patient's normal life, revision surgery becomes extremely necessary. The key steps in revision ACL surgeries which you have to focus on. The first is the graft selection whenever you are doing the revision ACL surgeries. For revision ACL surgeries, we need a new graft. Since the one which we had used for the primary ACL surgeries cannot be used, most of the surgeons in India, they use hamstring graft as the primary graft for the reconstruction. If this is used for the first time, then we cannot reuse it, and instead of that we have to find for an alternative graft. So what we can do is we can use hamstring graft from the other side. We can use peroneus longus graft, which is taken from the ankle, which is away from the knee. We can use quadriceps, which is a very good graft these days. You can use that, you get that above the knee. Or the best, which is the bone patellar tendon graft, which is extremely good for a revision surgery. But sometimes because of the pain in the anterior joint in bone patellar tendon graft, we prefer peroneus longus graft because it is thicker. We don't have to give a very big incision, and because of that the procedure is not very invasive. The thicker graft is essential to reduce any chances of failure. Now the reasons of failure should be understood properly because that's how you have to deal with the revision surgery. The first and most important is an infection. If infection is there, then you have to do the procedure in two stages. First, you have to remove everything which was inside. You have to remove all the endo button, you have to remove the screws, your ligament, because it is infected. Then after the whole healing happens after few months or after 6 months, then you can do the revision surgery. If the graft which we had taken was improper, if the graft was very thin and it was inadequate for the patient and because of which the failure has happened, then while doing the surgery we have to widen the tunnel so that the thicker graft which we are taking for the revision surgery can accommodate in that area. And the third is surgical error. If the femoral tunnel which was made in the primary surgery was wrong, it was not in a proper position, then we have to do it in two stages. First, we have to go inside, we have to clear up the tunnel, we have to fill it with bone graft so that it fills up that tunnel. We have to wait for a few months, around 6 months, so that that whole area is formed properly and we can make a new tunnel for a revision surgery. And in the second stage, then we make the tunnel and we do the final surgery. Now we have to think about the fixation and the implants. Revision ACL surgery follows the same principle as the primary ACL surgeries. We drill tunnels in femur and tibia. We use button or screws for fixation. Button over screws is a better option for the femoral tunnel. Whenever you do a primary surgery, there is a button already there. When we remove that whole graft, that button is left there. It is not going to cause any issue, and the new endo button will take its own position there. Now we have to think about the post-surgery protocol. We have to use braces. Unlike the primary ACL surgeries, braces are extremely important in revision surgeries because you have to give it some additional support for the healing process because it takes its own time and we have to support it. Weight bearing is delayed by at least 2 weeks to ensure the proper graft healing. Patients are advised to return to normal activities gradually after they start with the physiotherapy and the rehabilitation. Rehabilitation is a very slow going process. You have to be very careful not to put too much of stress on the graft. So after 3 to 4 months, once the healing is established, you have to start with the intensive rehab. Post-surgery, even emotional and mental support is needed because after the first ACL surgery which has failed, the patient feels discouraged, disheartened and little depressed. So failure is just a phase. Many of the athletes have gone through ACL surgeries which has failed, and even after the good ACL revision surgeries, they were able to go back to their sports, they were able to do their day-to-day activities. So don't be disheartened. You have to do your rehabilitation properly. You have to focus on not doing the mistakes you did before. Post-revision ACL surgery, you can get the pre-injury activities back by 6 to 8 months, but you have to remove the fear of re-injury because then the quality of life will be hampered. So studies have said even if after a revision ACL surgery you're staying active, you're doing the activities you're able to do before, the ACL re-tear chances are less. So go back to all the activities you're doing once your doctor tells you to. My final message is, don't be scared of a revision ACL surgery. The results are good. You have to trust your orthopedic surgeon. They will give you good results if you're not scared and you're willing to go ahead with the surgery. If this video was helpful for you, like, share and subscribe, and don't forget to click the bell icon. You'll keep getting the notification.